Welcome everyone to today's Schwartz Center Compassion Action webinar, Portraits of Compassion, a conversation with the 2022 National Compassionate Caregivers of the Year. Thank you for joining us. I'm Angelina McCoy, Member Experience Manager here at the Schwartz Center. As many of you know, we're a Boston-based nonprofit organization established in 1995 to advance compassion in healthcare. Our vision at the Schwartz Center is that everyone who gives and receives care experiences compassion. As part of that vision, for 23 years, we've highlighted exemplars of compassion, shining a light on compassion where it thrives through our National Compassionate Caregivers of the Year award program. In some ways, this program is closer than any other to the core of the Schwartz Center's work. After all, the Schwartz Center itself was founded in honor of the team of compassionate caregivers at Massachusetts General Hospital who inspired our founder, Ken Schwartz. Healthcare has changed since then, but compassion has not. Despite the many challenges facing our healthcare organizations and workforce today, these individuals you will meet today remind us that compassion is still thriving in every setting and every profession. We're excited to introduce you in just a moment. Before we do that, I'd like to share just a few details about what you can expect. Please note that the program will last 60 minutes with a panel discussion for the first 40 minutes or so, followed by some time for questions. Feel free to enter your questions in the Q&A pane throughout the discussion. I'd also like to acknowledge with gratitude that this Compassion Action webinar series has been funded in part by a generous donation made in memory of Julian and Eunice Cohen. With that, I'll hand it over to today's moderator. Dr. Beth Lown is Associate Professor of Medicine at Harvard Medical School and Chief Medical Officer of the Schwartz Center for Compassionate Healthcare. I know she's excited to get the conversation started.
Thank you, Angelina, and thank you to all of you for joining us today. I'm really excited to introduce you to our wonderful, wonderful panelists. First, I'd just like to say that unfortunately, Dr. Lindsay Carter, who's a pediatric hospitalist at Mass General Hospital for Children here in Boston, is unable to be with us today. We are missing her and welcoming her into our sort of community nonetheless. But I do want to introduce now Dr. Peter DeBleur, Chief Experience Officer and Emergency Physician at University Medical Center in New Orleans. Welcome,
Beth.
Peter.
Thank you.
William Donnie Nelson, nurse and a nurse manager of palliative care at both St. Francis Memorial Hospital and St. Mary's Medical Center in San Francisco. Welcome, Donnie.
Hello.
So fun to see everybody. Sadie Rodriguez, Dr. Sadie Rodriguez, pediatric cardiologist and intensivist at Children's Healthcare of Atlanta in Georgia. Sadie, thanks for coming.
Hi, thanks for having me.
Biba Tata Mbang, Masters of Divinity, MPH, BCC. Everybody has a lot of initials after their names. Manager of Spiritual Care at Mayo Clinic in Jacksonville. Hi, Biba.
Hi, Beth.
And
thank you.
Finally, Jason Tellis, nurse practitioner who is with us on behalf of the David James Hospice Unit team at the Edith North Rogers Memorial Veterans Hospital in Bedford here. Welcome to all of you and welcome to everybody in the audience. I will be asking some questions of our panelists because we're really eager to share how wonderful they are with all of you. But you should feel free to enter any questions or comments into the chat and feel free to really be stimulating us with any of the questions or challenges you're facing, and we'll do our best to pitch in and try to contribute in some way. So I'm going to start out, though, by asking each of our National Compassionate Caregivers to tell us a little bit about the kind of work that they do and the programs that they do. And I'm just going to go right across my screen and start with you, Peter.
Absolutely, Beth. So my training's both in emergency medicine and pulmonary critical care. And I've been practicing both at Charity Hospital and then its predecessor, University Medical Center in New Orleans. And my current role is as the Chief Experience Officer, and I've been in this role for the last 3 years. And in this role, I'm responsible not just for the patient's experience, their family's experience, our employees' experience, and all the providers' experience. So it's kind of, it's a lot, but it's incredibly meaningful to me. And that's my current role. Thank you.
Thanks, Peter. Tell us just for a second about some of the things that you've done in terms of programs and initiatives. You've done a ton, I know.
So we partner with our trauma psychologists, with our palliative medicine team, with our patient experience team, as well as the Spirit of Charity Foundation. And we've done things as far-reaching in palliative medicine as creating comfort care boxes that were filled with literature and treats and comfort items for not just the patient, but the family members. We've created a compassion cart, which is loaded with all kind of goodies, everything from lipstick to pens, to candies, to chips, to lunch bags and t-shirts that rolls through the hospital as a way of engaging employees in conversations, just as a check-in mode for the employees. And so that's a helpful tool that we've used as well as the Schwartz Center's programs, right? Everything from Schwartz Center and to the new Stress First Aid. So it's been pretty exciting. It's fun, very fun.
Yeah, thank you, Peter. Yeah, we have a great picture of you pushing that compassion card through the through the units, through the wards. Thank you. Donnie, you're next up on my screen here. So tell us a little bit about you.
Thank you, Beth. So I am the nurse palliative care manager for 2 hospitals, and we're probably about 3 miles apart, which could be like 100 miles apart at this point. I feel like we serve a few different populations. So I'm right next to the heart of Chinatown. And then also my other hospital, St. Mary's, there's a large Chinese population over there. So I work with a lot of Chinese patients in palliative care. And then also I'm in downtown San Francisco. So we have a lot of what we call disenfranchised patients or unrepresented patients. So a lot of the patients that I work with, they're dually and triply diagnosed. They suffer from poverty, homelessness, substance use disorder, lots of mental health, and a lack of resources. So on top of the palliative care I do, I think there's a lot of social work that I do with that. And I just want to give a shout out. I have the most amazing team, my medical director, Dr. May, my director, Carl Frank, and then my social worker, Mickey Au, and then my other nurse, Dennis Tyag. Thank you.
Thanks, Donnie. They love you too. Sadie, you're next.
Yeah, hi, thanks again for having me. As Beth mentioned, I'm a pediatric cardiac intensivist at Children's Healthcare of Atlanta. So at the bedside, that means taking care of children with congenital heart disease, mostly neonatal all the way up to their 20s. Sometimes it's around their surgical palliations, and sometimes they've had it a long time ago, they're repaired or palliated, but come in because they got the flu or, something that affects us all. Yes, and then otherwise, Children's Healthcare of Atlanta, CHOA, has been active in Schwartz rounds for many years and such a wonderful multidisciplinary venue where, so many different people can come together and really talk month to month about things that affect us as humans, which is where my interest has been budding over the years, is just really exploring the human side of what we do. Because it's not like we stop being who we are the minute we go through the doors or the minute we go to a patient family. And so how can we integrate all of the richness and complexity of who we are during, our interactions with our patients or our families or our coworkers, even our trainees, and not sort of have such a separation, but really an integration, just to allow that authentic expression that everybody has and we all need. We all would benefit from Peters and Donnies and Bivas and Jasons and Beths right in the world. Like, we need more of exactly who you are. And yet we're sort of taught and socialized to all kind of be the same. So that's where my current sort of passion project is using metacognition and cognitive emotional tools to help us find our purpose at work and help us find a more sort of authentic expression and really be free to embrace it and where we are. So working with the trainees currently, and in 2023, hoping to launch with the APPs, the advanced practice providers.
Thanks, Edith. That's a wonderful expression of your personal mission. You know, we bring our whole selves to our work. Thank you, Eva.
Thank you, Beth. Hi, everyone. I am the manager of spiritual care here at Mayo Clinic, Jacksonville, Florida. But before being a manager, I am a chaplain at heart, which means I bring spiritual and emotional support to patients, their family members, as well as to staff. So being with people is at the core of what I do as a chaplain. So it is just being with people, journeying with them, and understanding a sense of how they are feeling, right? Being a companion in their journey, in all the places where they find themselves, meeting them where they are at, in their places of brokenness, in their places of loneliness, in their places of grief, and at the same time creating that hospitable space, a non-judgmental space where people are able to share their stories and their experiences, and being there knowing that if I don't listen with intentionality, then I'll not be able to enter into their stories. And to me, that's where compassion resides, right? Be able to enter into their stories. As a manager, my role right now is mostly staff care. And here at Mayo Clinic, Florida, I have my team and I have developed several programs to support the well-being of our staff. Mayo Clinic takes pride in the well-being of our employees. So 3 of those programs that we've developed as spiritual care is Tea for the Soul. Some of you have heard about Tea for the Soul. It's a program where we bring hot tea and pastries to staff and just asking them to pause. Because sometimes they do a lot. It's just to pause and for us to say to them, we see you, we hear you, we affirm you. We say thank you for all the work that you are doing. So we nurture relationships in doing that. It's that moment where we have that shared connectedness with the people that we work with. And it just increases camaraderie right in the workplace. And people laugh and people say, oh, I have my hot tea in my hand. I feel like I'm on a first class flight. So it's a good feeling that we bring to the workplace. Another program that we've developed here is the SOS, which is support our staff. We go to work areas and we create a well-being space. Peter, is kind of like what you do, pushing that cart around. It just gives me joy when I bring these snacks, a lot of chocolate, and yeah, a lot of chocolate and crunchy bars, and we put this in this quiet space in a work area. There is also, we put thank you cards because we just know how important gratitude is. And we call people to say, write thank you notes to each other. Then we have a wall of gratitude. In the wall of gratitude, we have small easels. People draw or write whatever they want, put at their desk or give it as gifts to others. And then we have a sound in the background that just makes the space quiet for people to relax and refresh before they go to the next activity. Then, of course, we also have Schwartz rounds, which has been a great joy. People just telling us this is a therapeutic space. And we were skeptical at the beginning that if we're not doing it in person, how would that touch people? How will we feel that connectedness? But even across the screen, we could still feel that sense of connectedness and knowing that we hold a safe space where people could be vulnerable. So that's the work that I do, and that's what gives me joy every day.
Thank you, Biba. You have some shout outs for you in the chat too. People saying thank you. I love that expression of hospitable space. Isn't that wonderful? And I know for me, it's like, how do I create that for myself? It's hardest to create compassion sometimes for yourself, let alone to offer it to others. Jason, welcome.
Hi, thank you. Yeah, so I'm lucky. I represent a team of people. So I represent the Bedford VA Hospice unit. And so we're a 13-bed inpatient hospice unit, kind of in between what residential hospice is and what hospital level hospice is for veterans. And it's a unique place because we have a lot of the services that hospitals have, but we kind of a home-like environment that we can bring the technology from hospitals to bear on hospice care in an interesting way. And we have all kinds of services, podiatry, PTOT, psychology that can assist when appropriate, so and some of the initiatives we've put in place have been interesting. We have like a Last Wishes initiative where we've been able to meet people's last wishes as they're coming close to the end of their lives. And we've done all kinds of things. We've had weddings, we've set up a mobile bowling alley in the hallway of one of our units. It's some of the stuff is pretty fun. We've had parties for people. It's really tailored to different people, what they want and what their families want. So we've had we've been very fortunate to be able to do that for our patients.
It's wonderful. Thank you so much, Jason. So you know what, I'd also like to hear a little bit about what drew you to the work that you're doing. I mean, some of us have a sense of calling, some of us have experienced that very early in our lives, some because of adverse experiences or inspirational mentors. So I really would love to hear that little piece about each of you, if that's possible. So again, let me just start with you, Peter. Also, I'd love for you to share a little bit about Katrina, because I know there are a lot of people who might be interested in that whole experience. I know that was part of my growing up, in medicine, learning about that.
No, absolutely. I think what's drew me to this work is a commitment to our patients. And so we're committed to an underserved population. Charity Hospital is the oldest continually operating hospital in the country, and we're its next iteration. And so that commitment in 1736 was to provide care for anyone and everyone who could make it to the door. And so we continue to provide that care. And I think that that's critically important. It was never more important than during the time of Katrina and providing care. And at that time, the doors actually had to close in providing care. I was in the hospital during the storm, and within 48 hours, we had to close the doors to any more patients coming in because we couldn't provide care for the people that we had. Our generators were lost, and so we were working on just backup random generators to run ventilators, and that was it, and an occasional light. So 5 days in, we were finally evacuated, and my role at that time was to coordinate the evacuation of the hospital, both the patients as well as the providers. And I wound up being, the last person out of those doors and locking those doors, and one of the first people back into the city to provide care, along with a robust team of emergency medicine providers and internists from both LSU and Tulane and the military, to provide care and stability for those people who couldn't get out or wouldn't get out, even though we were under martial law. And so that commitment hasn't changed, right? We've simply changed. I'm now in a $1.2 billion facility that provides care to the same folks. And at the time that the facility was completed, there was a very powerful question in the community about whether they would be invited back to this brand spanking new state-of-the-art facility. And we clamored loud and long that they would be. And in fact, they are, which is tremendous. But it allows us to be a better partner to our community, and we continue on a daily basis to strive to do that.
Really wonderful. And the population has remained, pretty much the same as well.
Yes.
And your commitment is profound. I know you didn't have to stay in New Orleans. You'd make the choice to stay.
Right. And it's a tremendous team of providers who bridged care during that time. And this is literally a time of 10 years. You would think, if we were Boston or LA or San Francisco or Atlanta, that the political voice would be strong enough to stand up appropriate services within a relatively brief period of time. In New Orleans, the political voice is just not as strong as it is in those other mainstays. And so it took 10 years to move into a true facility. But in that time, from tents to convention centers to a Lord and Taylor department store where we delivered care for over 5 years.
God.
We're very pleased, and we believe strongly that our patients deserve the facility that they're currently seeking care in.
That's great. Thank you so much, Peter.
You're welcome.
Donnie, can you say a little bit about what really pulls you, what draws you, and what was the initial draw to the work that you're doing?
Well, I mean, I told the story, I think, when we first met, and so I'll try to keep it brief, but I'm not ashamed to say that I'm a beauty school dropout, but I had no intention of ever going into healthcare. And so many, many years ago, I met somebody and I just knew him for a day, and I gave him my phone number, and I never heard from this person again. And maybe about 2 weeks later, this was, gosh, I was 21 years old, so I won't say any numbers so you can do the math, but that was back when we had those old voicemail machines. And one day I came home from work and there was a voicemail on there saying that we have this young man up in our ICU and we think he's brain dead and we don't know who he is. So what had happened was this person that I had met that had given my phone number to, I just wrote down my phone number on a little piece of newspaper, and I guess he had it in his wallet. And he was attacked in downtown San Francisco, and then he was mugged, and they took everything and all his clothes, and they just left a wallet on him. In the wallet, in one of the little pockets, I guess, my phone number was tucked in there. It didn't even have my name on it. So for that week, they called me in and I went up and I realized who that was. I knew this person very little. I was able to say that his father lived in New Mexico, which is where I grew up. And his dad came into town and I spent the whole weekend with them, and this really surreal moment. But I just saw how amazing the staff was in that ICU, and it changed me in a certain kind of way. I mean, I'm a kid that grew up in the system, so I always felt like I was going to go back into some kind of work where I was going to be given back, but that really helped directed me that I was going to be in hospital work. And so 20 years later, I am working in an inner city hospital where a lot of times we find people who are unrepresented, and I have a really strong team. We do lots of work with trying to find who loves these patients, and it's really difficult to do. Luckily in California, we don't have like what we call a hierarchy of surrogate law. So sometimes it's easier for us to use somebody who knows this person, who's a friend, sometimes it's a neighbor, whatever we can do though, to let these patients know who, what their wishes are, what their value are when they're not able to speak for themselves. I get to do that today. But yeah, that one little story just completely changed my life into what I'm doing today. And I just have the most amazing job.
Thanks, Donnie. There's this one question that I know you ask of patients who have nobody to represent them, which is, who not just who knows you, who loves you. And I just love that question. I just think that's so profound. It's a wonderful question to ask. Thank you for that work. So let me then switch off to Sadie. I'm just going around the bend here.
Donnie, I actually didn't know that story. That's incredible.
Love it.
Thank you for sharing. Yeah, it's so wild what things might seem insignificant that can totally change the trajectory of our lives.
Right.
Yeah. My dad and my older sister are both pediatricians, and I thought, I don't want to do the same thing as everyone else. I don't want to go into medicine. I'm going to find my own path. And in college, I served some time in a clinic for the uninsured and underinsured for my, to do some Spanish translation. And being in the closed doors with these patients or patient families, and having the privilege to hear their stories, hear their struggles, their barriers, their challenges, sometimes injustices, really cracked me open to want to just be with people. Sort of as Biba was saying earlier, to hold space for people and be with them exactly where they are, not asking anything of them, not, expecting anything of them, just wanting to be there in sort of that intimate, safe space, I found so compelling. And that, I think, my whole journey along my medical education and career has always been a very heart-led one. Of course, the anatomy and physiology and the science is all, very cognitively stimulating, and I enjoy it. But all the decisions I've made, I would have never known what the next step was until I experienced them and got to work with pediatrics and fell in love with them. And then, the next step came, it was critical care. And there again, we're the most vulnerable of the patients. And I, again, just felt so called to just sit with them. And then, again, same with cardiology. And I would never have known 15 years ago where I would have ended up today. And I say that just to hopefully encourage anybody who feels lost or feels unsure or that their path is ambiguous, that you don't have to know the big picture. You just have to know the next right step for you. And hopefully with some trust and surrender, those heart-led decisions will guide you and things will become more clear. And I just want to offer that as some hope. That's how my path was. It was not at all written out or clear in the beginning. It was really the patients and families that showed me the way.
Yeah, thank you. Said it, spoken as a true mentor, It is so true that the process of being with is really what fills us with joy in medicine, or in healthcare, or in any of the fields, represented on this screen, and everybody sitting out and listening to you. It is what brings us together, that sense of connection, that common humanity, and that spirit of love, I think, that really is what gives us joy in the work. I know medicine is a lot about cure and that sense that we need to do to people, but I think being with people is so incredibly important and something that's not taught quite enough to some of us growing up, and in training. Biba, can I ask you to speak a little bit about what drew you and how you felt called to do the work you do?
Sure. I come from a background of health counseling. So I used to be health counselor for HIV and AIDS patients. So I would counsel them before their test and after the test. And I would use the script, right, to do this. And as I continued to do that work, people started asking me difficult questions. Why am I having this disease? There's a lot of stigma in the community. Why do I even have to keep living? And the one story that stands out to me, or that stood out to me at that time, was this lady who was pregnant and HIV positive, and then her husband was negative. So she was devastated. She was frustrated. She was very angry and asking the question, why me in this relationship? Why am I the one who is positive? What is going to happen to the child that is in my womb? And if I die now, what will happen to my other children? What will happen to my family? Very hard existential questions. And I looked at her, I didn't know what to do, but one thing that I did was put down the script. I had to put down the scripts and connect with the human spirit, being a witness to that woman's suffering. To me, that's where my career was born. I knew two things. I did not want to be a nurse. I did not want to be a medical doctor, but I wanted to be this person who would sit at the bedside and hold people's hands and say, yes, I hear you, and listen with them from my heart. That it is that moment that drew me to this work. I didn't know the name for this kind of work was chaplaincy or so, but I knew exactly what I wanted to do. Like I said, you were saying, sometimes you don't know. I knew, but I didn't know the name, how to call it. So it was a great discovery for me when I came to understand that, okay, this is chaplaincy, this is a kind of work, and I said, yes, this is what I want to do with my life. And so compassion for me has evolved, has taken so many forms over the years, but it is still that moment of witnessing, of coming face to face with the suffering of other people. And so that's why I said earlier, Beth, that it's creating that hospitable space. So when I think of compassionate care, for me, it is hospitality. It is creating a sacred and a safe space where people can feel both vulnerable and comfortable to share their deepest concerns. And to me, again, compassionate care is listening with attention and empathy, listening to be able to understand what the other is feeling. And lastly, for me, that compassionate care is solidarity. I know compassion cannot be done in isolation. So there's that solidarity of how am I partnering with other people, whether it is individually when I go into a patient's space, or whether it's providing staff care, like here at Mayo Clinic, Florida, I partner with other teams to do the work that I do. I partner with my well-being team, humanities in medicine, and nursing, who have been great supports to me to do this work. So there's that solidarity, like standing side by side, and we are witnesses together in this work. So that's what pulled me, and that's what I continue to do.
Yeah, I love that. You know, we forget sometimes that the root of the word hospital is hospitality. You know, we don't associate that with that word somehow. Thanks so much, Biba. Jason, how about you?
Yeah, so I've done enough interviews in hospice and palliative care to know that everybody I work with has a different personal story what brought them to do this work. And I can tell mine, but understanding everybody has their own. I experienced a traumatic death early in my life in high school. A friend of mine shot and killed himself, and through that process, people really supported us quite well. We had psychologists and other people, teachers, that helped us quite a bit through that process. And then fast forward to later in my life, I decided to go to nursing school, and I started working as a nurse's aide. And the first person I took care of in the nurse's aide training wasn't alive. She had passed overnight, and I came in to take care of her. And I think as a nurse, one of the most sacred things that we do is the aftercare of somebody that has passed. And so taking care of and cleaning up and getting ready for somebody to go was like tangibly felt important to me. And then having the family come in afterwards and talking to them, it just felt like I was then on the other side of that. I had moved to the other side where I was helping somebody else to come through to the other side of somebody dying. And so that's when I kind of knew what I had to do to go through and finish and do the hospice and palliative care and work with in end of life and terminal care.
Thank you, Jason, for sharing that. I'm sorry that happened to you so early. I know you can't speak for everybody. Everybody has their own reasons for going into the work that you do. So I'm just going to ask, I know that your team is drawn by a sense of common mission, but I wonder what it is. How does that show itself in the day-to-day? How do you feel that? How do you experience that?
I think, there's a common mission, and we do hospice and palliative care, but it's within a veteran population. So there's like another level and another dynamic on top of it, which is taking care of veterans that have served our country. So I think there's the common mission of end of life care, which feels important in itself, but then there's also that common mission of taking care of veterans, which feels doubly important. So a lot of us have that mission in mind too when we take care of these men and women.
Yeah, for sure. Do you mind telling the story about the World War II parachutist? I just love that story.
Oh, I don't know if I know the whole story. Our nurse manager wrote it in our thing there, but there was we had a veteran who he wrote we have things like dignity therapy and these sort of things where people write their stories as a kind of legacy work. And part of his story was that he talked about how he had to pack somebody's parachute and how that was, they packed each other's parachute as it was an important thing that they did for each other as veterans. And how we were packing his parachute. He felt like we were packing his parachute for him to go.
Yeah, yeah. It's just a beautiful metaphor, really.
Yeah.
I love that whole story. Speaking of which, Biba, do you mind sharing a little bit about the work you've done, the spiritual life review? Can you explain what that is? It's some of the research that you've done.
Yes. So the spiritual life review program, Jason, is like we took part of the dignity therapy work and added spirituality to it, and we did it with cancer patients, starting with patients with brain tumor, knowing that that population would easily lose cognition as their disease progresses. So we wanted to give voice. We called the study the Hear My Voice study. So we wanted to give voice to people before they come to that place where they're not able to express themselves. So we thought of the best way to do that would be to do this life review process. So we engaged them in conversations about their values, their beliefs, their life learned wisdom. And then we made legacy booklets for them. It was just the most powerful thing ever, because when these patients held those books and read their own stories, it was just different from what I said. Did I really say all these things? This is my life. So it was like my lifespan in review. And the feedback that we got from family members, some grandchildren saying, oh, I never knew this about grandpa. I never knew this about grandma. It was like great stories about their lives. So legacy work is an important work for serious patients, serious illness, chronic illness, end of life. It just makes people to sit back and reflect on their own lives. And that's a journey, right, that we do with people every day, is coming into that space and say, who are you? What's your story? So we collected these stories and we made them into those legacy booklets.
That's wonderful. Thank you so much.
You're welcome.
You know, we've been through some hard times during the past few years, and I just wondered how this has affected each of you. You know, I'm going to mix it up and start on the other side of my screen. Donnie, can you start us off on that? What's this been like? How has it affected you and your team, your work? And if you want to share also, you know, a story about something that kept you going during the past few years, that would be great too. But start off with what the impact has been of the disruptions of the past almost 3 years.
Well, gosh, that's a long one, but
Story.
I was just thinking about, I remember when we got the notice at the hospital that we had to shut everything down and no visitors allowed. As a palliative care clinician, what I do is I do lots and lots of family meetings. And when I have a sick and dying patient in the hospital, if I'm obviously in the ICU or on the floor or wherever, part of the work that I do is to bring the family in, or the loved ones, and help process that. And there's this transition that's happening. We're all there doing it. And I think healing for me in these situations is I have this face-to-face interaction. You know, a lot of the work that we do is intuitive. And so when this moved on to a WebEx, onto an iPad, and I probably have about 37 times I held somebody's hand and I was the surrogate son, the surrogate brother, the surrogate somebody for somebody, while a family was on an iPad after we had extubated somebody from dying from COVID, and they died, and this family is processing on there. I mean, I also went in and maybe about 6 times I was the surrogate priest to go in and do anointing of the sick, while we had a priest outside the hospital doing the prayer on the phone with the family watching, and I'm in there kind of doing that too. Just, it was amazingly difficult to get through that. And I think probably I remember maybe like in the summer of 2020, I was calling this wife of a patient. He was in his late 80s and he had been hospitalized since January. And, you know, how hospital works a lot of times is a person goes into the hospital and they're not doing so well, then they go to a SNF, and something happens and they go back to the hospital, then they go to another SNF, then they go to a different hospital. Then it's nuts. And what I realized when I called this woman on the phone to have a goals of care conversation with him, she said she had not seen her husband in about 6 months, and they had never been separated in like 60-something years for more than 48 hours, she said. And she had been called by hundreds of people. She didn't know who she was talking to all the time, and they were asking labs, they were asking physical therapy things, all kinds of stuff, and she was really confused just who she was talking to. And when we started doing that, everybody was getting into Zoom and webinars, all this tech, and I didn't think anybody was thinking about a lot of these elderly patients that we had that only have a rotary phone, and that's as good as it was going to get. So I think some of my bosses on here might get a little in trouble. It's been a little while since that happened, but I snuck out a few times and I was masked, and I would have people come down, and I put my phone in a Ziploc bag and clean it, and then I hand it to this person through the gate so they could see their loved one. And then we had an iPad in the patient's room while we were able to do that. And I think we should have done that a lot more times. I wish we could have had the resources in the program to do that. But through that really dark time, and I talk about this, I do lots of nursing competencies, and I think there's this thing that we talk about now, that a buzzword called moral injury that we're going through, all these things that we had to do that just gave us this element of moral distress. And I can tell you, like, having a family very angry at you because you're not allowed to come into the hospital on a phone was just something really difficult. And I felt like I got to work with a lot of my staff kind of go through that. I did just want to make a note while we're on there that one of the things that we started just about that time was something called Code Lavender. And it's not as fancy as the Schwartz rounds, but definitely what I think it does is when this sudden event that happens, or one of our team members in a certain kind of way that might need a little extra support, is that we deploy a cart. And in that car are things to help kind of just ground us a little bit. So obviously we have the lavender essential oils. We have some things to color. We have some really fancy hot tea. We have these little warm towels, which at first I thought was a little cheesy, but it is an amazing thing. But this sense of touch when you're holding this warm thing of the safety, and everybody's going in a circle. If we were able to take this moment to do just a little debrief, like if there was a sudden death or what we're starting to see a lot right now is a lot more violence toward healthcare workers, especially in the inner city where I'm at. So my ED staff is just pummeled daily, and we're short staffed. There's a lot of things that are going on. And so what I feel like my team and what we're trying to do is just create this space. And I've heard that happen here a few times. Just real quick, I remember being in nursing school told to say that we have this thing called nurse space, and that means you're not supposed to show any emotion. You go in, sometimes you're going to smell things, sometimes you're going to see things, sometimes the things are going to happen, but we're not allowed to show emotion as healthcare workers, whether we're a physician, whatever like that. We're there for patient care, but we see so much trauma, and we do all these things. And I don't think as healthcare workers we take this moment to just breathe and remember the awe of what we're doing. Like, we are having this bird's eye view into this person's life that is life-changing. It's a new normal for them. A lot of times that's happening. And so it wears us down, it hardens us, it gives us compassion fatigue, it gives us burnout unless we stop and we think about it and we talk about it and recognize it. And I think as a team, when we do these things, it's really brought us a lot together. And I'm real appreciative towards the Schwartz rounds because we've been able to give this space. And when I say we give this space, I feel like we're able to give permission to feel. There's a safe space so that we can talk about this thing. And we're not talking about what happened. We're not talking about anything other than how do we feel in this moment? I'm pretty sure a lot of healthcare workers that I work with is when you go home, there's nobody to really get it, what you've been kind of going through. It only takes somebody who's been in it with you in these trenches that you're able to talk about it. But come in the morning, we work, we go to trauma, we stuff it, we go home, we have to live our lives. But just to take a minute to recognize this thing that we do, it's just an amazing opportunity that I'll be able to get. And I just have the most amazing teams that I work with that we've just gone through so much in these last 3 years, and we survived. I think there's light at the end of the tunnel, and things are going to normalize a little bit. It's going to be a new normal, and we adjust to the new normal. And the new normal is going to keep happening every year, it seems like. But how are we taking this moment to breathe in that and just be here in this moment with each other? Anyway, I think I'm rambling at this point.
No, it's wonderful, Donnie. Thank you so much. And everybody out in the audience, feel free to, chat into the chat, any thoughts or reflections you want to share as well. Yeah, I mean, this idea that, I think many of us are taught we're not supposed to show any emotions. And that gets back to what you were saying, Sadie, about bringing your whole self into work. I mean, you don't just check your your heart at the door when you, when you walk into work. It's crazy. But I have to say, you know, often in training too, we do that to patients too. We don't consider how emotions, how their social context, how their spirituality, how anything else other than, you know, their physiology is affecting their manifestations of illness. And that is just, I think, a huge, huge lacune in the way we are trained. Actually, Sadie, do you want to say any more about how, you know, the past few years have affected your work, your team, you?
Yeah, I was thinking more to the beginning stages of COVID when like we didn't know anything and we were so scared. And I will always remember the first day coming back to work. I don't live that far from the hospital, so I drive through lots of little neighborhoods. And I remember starting the drive off totally like fear-based, constricted, you know, breathing. And house after house, I started noticing signs in the yard. I don't know if you guys remember this, of like, you know, first responders, like, we've got you, we're proud of you. And I was so blown away, like, who are these strangers that are, you know, with us? And it was just such a sense of like something bigger than yourself. And getting to the hospital, and during those first few months, there was all of this like sidewalk chalk art of like rainbows and hope, like big word hope, or, you know, thank you, or just encouraging words. And it just inspired such a bigger sense of community. I think when you're so patient facing, you can feel lonely. You can feel like that's all you're focused on is someone else, without taking the time to even focus on your team or yourself. And for somebody else, you know, or almost to use what Biba was saying earlier about the witnessing, how that is powerful, but it was almost a feeling I remember of just community that was outside of us, being able to witness what we were going through and almost in a way sort of validate your fear, or, you know, the need and the ambiguity that was causing distress, and even coming home and watching like a UPS commercial, like something not even healthcare related, that was thanking all the first responders, you know, policemen, or not just medical, but I would just remember being so blown away and touched by that. I think in some way or another, we are all the walking wounded, and that human connection, back to the connection that you were talking about, Beth, mitigates trauma and it mitigates our pain. And having like the rest of the world show up for you was like mind-blowing, because it's the reverse, right? You go into this field to serve others, to, you know, to put the focus out there. Yeah, and I think what Dottie said is also really powerful. I think that is the next stage, and I think the culture shift, I think it's coming. I do. I think we talk so much about wellness and burnout, and I think, you know, the paradigm is slowly shifting from being these like superhumans to now being human, and we're more and more recognizing our humanity as providers. And I think that with time, with shift, I hope, and I think it is being more invited to offer that connection. I think someone wrote it in the chat that authenticity promotes trust. And I think that the historical context of medicine probably has values that are now shifting. You know, if you would have asked me a few years ago, like, what is compassion? I would have thought it was very like doing. And now I think as we are shifting and appreciating other qualities that haven't traditionally been appreciated, like the ones in this webinar, like the ones that Schwartz appreciates, things like just being, things like being present, things like, your heart space instead of just your head space. You know, the currency in medicine has always been, what is your cognitive ability? How fast can you answer the question? How efficient are you? How much do you know the literature? You know, which has its place. I'm not, minimizing it, but there are other values, the ones that we're all talking about today, again, that bring the human connection, that I think are slowly more and more becoming more, not just apparent, but valued. And people, like everyone on this webinar has an interest in how can we explore that? How can we support it? How can we enrich that in ourselves and in each other? And that gives me hope that the change has started to come and will continue to come.
Thanks, Heidi. That's, I learned from teachers who are expert in the impact of trauma on people, on populations, that there's sort of this timeline of what happens to people where, there's sort of anticipatory anxiety, and then, whatever it is that's going to happen happens. And then there's hope, and the community comes together and really tries to support each other, everyone who's been impacted. And if it lasts for a long time, whatever this disaster or trauma it is, then there's this sort of descent into dispirited disillusionment. But that doesn't last forever. And what these teachers have showed me is that curve comes right back up. And sometimes it comes to a place that's even better than where we started in terms of community resources and it's called social capital. I don't like that term so much, but the sense of community and collective resources that can be tapped and accessed and shared. So it's interesting. We have some questions. We were going to ask this anyway, and I do want to hear what aspect of your work supports and sustains you now. So Jason, let me start with you.
Well, I mean, I think even though end-of-life care seems like it could be depressing or something, I think there's just really poignant moments of beauty that you're kind of like fast-tracked into by being present for that. And, you kind of quickly learn people's goals, wishes, and values, and then can kind of operationalize a plan around that. So I think it's easy to sustain yourself when you see the work just have such a tangible effect on the people you're trying to help. It's pretty immediate too. And then also during COVID and everything else, the collaboration with the other people in the team that's very sustaining, I think. Just to have other people in the soup with you that are doing the work with you, and very supportive people that you collaborate with, but also you've never met in your life. You just see them on a TV screen and they're working in a different area. It's amazing how people came together during that to support each other and us.
Thank you, Jason. Yeah, you have a very strong team. It's quite inspiring, actually. Peter, how about you? What is it that sustains you, and how do you sustain yourself? That was one of the questions in the chat.
I think one of the things that we've heard echoed in this entire panel has been the power of team and surrounding yourself with like-minded individuals who know the value of trauma-informed care and know the value of asking folks, what has happened to you as opposed to what's wrong with you, and having that be a standard. And then understanding that your team, at some point in time, somebody else will carry the other person, that no one individual is expected to carry the load all the time, and that we're allowed to have rough days. We're allowed to have, the analogy I use, we're allowed to have our compassion bucket empty, and we have to know ways to refill it, right? And whether that's exercise, whether it's prayer, whether it's meditation, whether it's seeing the next patient, and understanding the privilege that presents, right? And sitting in that, as we said, and being with people, but understanding that is rare and it is special, and that normal people don't get to bear witness to that. And that if we value that for the specialness and the intimacy that it is, then it's a way to refill our own buckets, right? That compassion isn't just a one-way direction. We benefit through acts of compassion.
Yes.
Acts of compassion reduce our burnout. They don't increase it. They reduce it. When we empathize with people and bear witness to people and aren't moved to action, and as Sadie said, that action can simply be being present. That is action, but that presence needs to be with. It can't be without. It has to be with the individual, with the presence to get benefit from it. But if we're doing those things, we're refilling our bucket.
Yeah. Yeah, I think that's such an important point. And there's so much research now to back that up. You know, that acts of compassion stimulate all those reward centers in the brain and make us want to return again and again to sort of dip our toes into that well. I'm curious to hear from the others. So Biba, tell me a little bit about what sustains you and how you sustain yourself.
Peter, I want to say that we are on the same wavelength. You talk about filling the bucket, and I was sitting here thinking about emotional bankruptcy, because I know that if I go to my bank account and I keep taking out money without any income coming in, I'm going to go bankrupt, right? It's the same with we in healthcare. We give a lot, we give and we give and we give, but we have to replenish, right? So I always say to myself, don't allow yourself to be emotionally bankrupt. I say to my colleagues, I say to our nurses, don't allow yourself to go emotionally bankrupt. Is that nourishing? Because compassion, as you say, it's not supposed to be draining, right? Compassion is supposed to be that thing that lifts us up, and we feel it, we see it, and we just keep going back to it to tap into it. So we nourish ourselves. So my own wellness is very important to me. It is prayer. It is my faith that keeps me going. It is surrendering to God and saying, this is it, I've carried a lot. It is heavy, take it from me. So that keeps me light, and it just keeps me going. Then one of my mentors shared something with me that has really upheld it since. The 4 C's, which is call, center, connection, and contribution. So call means I keep going back. Why did I come to this work in the first place? What was my original calling? What was that moment for me that I encountered that woman and that moment of witnessing, right? And centering is, what is my anchor? What holds me? I don't want to lose that thing that gives me meaning and purpose. Then there's that connection. How do I connect with people? What do I bring? Contribution now, the last one is, what do I bring to the table? Are there things that I want to keep giving, or things I want to graciously also receive from people? How do I give of my own kindness? And just that smile that I bring every day, what do I contribute? So these 4 C's, and which I'm adding a 5th C now, which is challenges. How do all these things happen in the midst of the challenges that are always there in healthcare? But I keep going back to my calling and keep finding things to center myself. And it is the people, right? Sometimes what my anchor is the people that I work with, the teams, the collaboration, the solidarity that I was talking about earlier. Without these people, I cannot do any work. I always say to myself, I have the best team that surrounds me to do this. So I have the best team of chaplains. I have the best nurses are my greatest allies. My humanities in medicine team, my well-being coalition team, we do this work together, and that is what sustains me and keeps me going.
Call, center, collaboration, contribution, is that right?
Connection.
Connection.
Connection, yeah.
That's wonderful to remember. It's so important to sustain ourselves and to know when we need to step back and just to take care of ourselves as well. However you find that, whatever that is for you, I think it's very hard to remember to take that time for yourself. But without it, as you say, we can't function, and we can't get what we don't have. We need to sustain ourselves and replenish that. So we're almost at time. My gosh, that went really fast. I'm sorry, Angelina, you just popped up again. And I suppose that means we have to end.
Yes, I don't want the conversation to end, but thank you all so much for the panelists and Dr. Lown and everyone who joined us today. You can also learn more about everyone here today on our website, so check that out. We hope you enjoy this webinar, and keep an eye out on your email for future events. And please take a moment to fill out the brief survey we'll be sending you after the webinar. We really appreciate your feedback on today's session. And thank you again for joining us, for your commitment to compassionate healthcare. We hope you take care of yourself, and we hope to see you soon. Thank you.